Good morning to everyone, to the sign language interpreter, to Lázaro Manuel, and congratulations for the documentary you developed concerning the indisciplined behavior we're currently facing, and also to everyone who listens to us from different places. With your permission, I'll remove the face mask considering the social distancing we keep in the studio. Our country presented yesterday some not too positive indicators. There are 595 COVID-19 patients admitted to our hospitals, 18 under medical supervision, 301 are suspects, and 276 are confirmed active cases, the highest figure in the last weeks. In our primary healthcare system, 6,711 people are being monitored by our professionals and specialists. Yesterday, we managed to increase the figure of processed samples to 3,876 at the molecular biology laboratories. At the Tropical Medicine Institute Pedro Curie, 1,742. At the Provincial Center of Hygiene, Epidemiology and Microbiology of Havana, 604. At Villa Claras, 408. At Santiago de Cubas, 283. At the Genetic Engineering and Biotechnology Center, 429, at Hermanos Amejeiras Hospital, 313, and at the Laboratory of the Civil Defense, 97. As a result of the studied samples, 49 people, a significant number, tested positive for COVID-19 in our country. Thus, we accumulate 285,471 processed samples and 2,795 people, which represents the 0.97% of all analyzed samples, have been diagnosed with COVID-19. Yesterday, as in previous days, and considering the epidemiological complexity, the entire country collected and analyzed samples. In Artemisa province, and we are aware of the current sanitary situation, 632 samples were studied. In Havana province, a higher number, 2,466. In Villa Clara, 129. In Ciego de Ávila, 111. In Santiago de Cuba, 97, and so forth in every Cuban province. The 49 people diagnosed yesterday are Cuban. 41 of them are confirmed case contacts, and they were already hospitalized in isolation units prepared especially for confirmed case contacts. Some of them are direct contacts, others are contacts of contacts, but they are always linked to previous confirmed cases. So we accumulate 2,361 people that have been confirmed case contacts. 6 patients have their source of infection abroad, for a cumulative of 235 people whose source of infection is abroad, which is a 8.6%. The source of infection of 2 of them is yet to be determined, for a cumulative of 136 people whose source of infection is yet to be determined. 25 are male, and it maintains a balance in the percentage of infection in both genders. That is, 50.2% of all diagnosed patients are male. 24 are female, which represents 49.6%. 32 of the new cases are asymptomatic. That means that the 55.7% of all confirmed cases in Cuba have been asymptomatic. Concerning the last 15 days, the figure will reach a 63.1%. A great hazard, since we don't know who may carry or not the disease. So, if you don't follow the protection measures, there's a high risk you can contract the disease. Of the 49 new cases, 7 individuals are under the age of 20. In this regard, we will provide a detailed analysis in further emissions concerning the constant incorporation of people under the age of 20 and even younger ages, because yesterday we detected 7 cases in this age group, but between 20 to 39 years of age, and are still considered young people, we detected 22 patients, which added to the previous group, amounts 29 people under 39 years of age. In the 40 to 59 age group, 16 cases were detected, and with 60 or more years of age, 4 people, for a cumulative of 317 confirmed cases under the age of 20 in our country. 282 of them are discharged, for an 88.95%, and as we always remark, they present a stable evolution, but still under risk due to the complications inherent to the disease. Of the new positive cases, 24 belong to Havana province, 19 to Artemisa province, 2 cases belong to Granma province. Matanzas, Mayabeque, Villa Clara, and Holguín provinces reported 1 case each. In Artemisa, of the 19 diagnosed cases, 18 belong to Mariel municipality and 1 to Bauta. In Havana, the 24 positive cases belong to Habana del Este, Marianao, Playa, La Lisa, 10 de Octubre, Plaza de la Revolución, Cerro, and Boyeros municipality. There's 1 diagnosed case in Matanzas, in Jovellanos municipality, 1 case in Mayabeque province from San José de las Lajas municipality, and in Villa Clara, 1 case from Camajuaní municipality. So, of the 49 cases detected yesterday, 6 are imported. The 2 cases reported in Granma are imported cases, 1 in Havana province. The diagnosed cases from Mayabeque, Matanzas, and Holguín are imported cases as well. Thus, Artemisa maintains the highest rates, followed by Havana province and Villa Clara with a similar rate. Of the 2,775 patients diagnosed with the disease until yesterday, 276 are still hospitalized, as we had previously mentioned. These are active cases, one of the highest figures, which represents a 9.9% of all diagnosed cases. 272 and 98.5% present a clinically stable evolution. Fortunately, we did not have any deceased patients yesterday, and the mortality rate in Cuba reaches 3.17%, which, when we compared to the regional rate of 3.72% and the global rate of 3.78%, places Cuba in the 21st position in the Americas and the 113th in the world. We always mention the 2 evacuated patients at the beginning of the pandemic. Yesterday, 13 patients were discharged, a number in accordance with diagnosed patients 10 days ago, but still not enough in opposition to the amount of diagnosed cases yesterday. This way, the 86.8% of all diagnosed people in Cuba are recovered, that is 2,409 people. We had previously reported patients in serious conditions. Today we report 4 confirmed patients in serious conditions. They're being treated in the ICU, and I repeat, today we report 2 more patients in serious conditions, which emphasizes that we're not dealing with a minor illness, as many people think, and even say this is a simple flu that may bring some complications. And I say that's not correct at all. It gets complicated, in spite of the effort made by our health professionals, our treatments, and our protocols. As our President Díaz-Canel stated yesterday, we have no excuse for not fulfilling with established measures. Yesterday, as a consequence of the number of cases reported in Mariel, it was also informed that a new focus of local transmission would be opened in a construction and assembly enterprise located in Mariel. Hence, a set of measures will be adopted in cooperation with provincial authorities and the government parties of Mariel. This is the current situation in Cuba, not a favorable one compared to what had been achieved in previous days, and I repeat, there's no excuse for this kind of behavior. We have identified a series of violations and a non-compliance with the restriction and protection measures, so far known by everyone. The fact that a group of irresponsible people have failed to comply with these measures will lead to the implementation of a new set of measures in the following days. For the global outlook, the current behavior remarks how difficult it is to control the disease, inasmuch practically all countries, 185 countries, remain to diagnose COVID-19 cases. The world accumulates 18,519,579 confirmed cases, since 256,037 people were diagnosed only yesterday. 6,813 people died yesterday, a higher figure compared to previous days, for a cumulative of 700,539 fatalities due to the disease and a mortality rate of 3.78%. The region of the Americas represents a 54.01% of worldwide diagnosed cases and accumulates more than 10 million infected people, 10,003,225 confirmed cases. Since only yesterday, 145,424 were diagnosed with the disease. 4,430 people died yesterday for a cumulative of 372,000 388 fatalities in the Americas region, for a mortality rate of 3.72%. I just wanted to highlight that in the United States, 1,403 people died yesterday and 1,154 in Brazil. We have prepared a chart that will help us illustrate how a person that does not wear a face mask and keeps 1 meter or half a meter of distance can release a certain amount of infected saliva droplets. The amount of released droplets decreases while using the face mask. Therefore, we explained that it's not a matter of using a face mask, but rather using it correctly and keeping a social distancing that will prevent us from being infected by these saliva droplets. As our president expressed, and I quote, "We have no right to ease our behavior. We have no right to diminish the risk perception. There's no right to lessen the implementation of measures." This is all the information I can provide. I appreciate all people who have made possible this broadcast, to Lázaro Manuel, to the sign language interpreter, and most importantly, to everyone who listens to us and complies with established measures. Thank you very much.